Welcome, everyone, and thank you for joining us. We're going to give it just a minute to allow a couple more participants to come in, and then we'll get started shortly. Okay, so I think we're going to go ahead and get started because I want to get to our panelists and our great conversation tonight. So welcome and thank you all so much for joining us for tonight's event, Investing in Our Communities, Making Change Through Practice, Policy, and Passion. I'm Dr. Lisa Martin, Associate Professor and Interim Department Chair of the Health and Human Services Department in the College of Education, Health, and Human Services at the University of Michigan-Dearborn. We're super excited tonight to have our three panelists here, and I'm very eager to start our conversation. Just a few housekeeping notes before we begin. First, I think you all have been alerted we are recording tonight's event, and we do plan to make it available for those who are unable to join us live. Second, we're in webinar mode, so our audience's cameras will remain off and your audio will remain muted throughout the event. But we do hope to save some time at the end for audience questions. If you have a question for one or more of our panelists, please use the Q&A function at the bottom of your screen to submit your question, and we will try to get to as many as we can at the end of the event. It is always a wonderful time to be able to spend with our alumni and our extended community, even if we have to be remote. And I thank you all for taking the time to join us this evening. I'm tonight's official MC, but I did not plan this event alone. And I would very much like to thank the team who made tonight's event possible, including Dean Ann Lampkin-Williams, who's behind the scenes and attending, as well as Associate Dean Stein Brunvand, Christine Frendo, Director of Alumni Engagement, and Sarah Dorchek from the Office of Institutional Advancement. I want to thank everybody who worked really hard to bring this event together. Just before we begin, I wanted to do a little quick state of the Department of Health and Human Services to give a quick update for our alumni and those who might not have connected with us more recently. So the department has a lot to be proud of these days. We continue to see enrollment growth in our programs at both the undergraduate and graduate levels. Our students are excited in learning in the classroom, from our Introduction to Personal Health and Wellness courses to our Intro to Public Health class that is taught by one of our esteemed panelists who's with us tonight, to Dr. Sampson's Organizing for Community Change. And our students not only like to learn in our classrooms, but also like to apply that knowledge to the world. So whether it's the continued growth we've seen in remote internships during the pandemic, or to placements and continuing their education once they leave and graduate. Many of our recent grads elect to continue their education in graduate school. We've had students go on to obtain their master's in public health at the School of Public Health in Ann Arbor, in epidemiology, health management and policy, health education and health behavior. Students in our human services track have been placed in both the Ann Arbor School of Social Work, Wayne State University's Master's in Social Work program. And this year, we're super proud to have launched our inaugural class in our 4+1 program in partnership with the School of Social Work in Ann Arbor, where students can simultaneously complete their senior year of their undergraduate degree in Health and Human Services and begin their first year in their MSW curriculum, allowing them to fast track their MSW degree completions. Our student group, the Public Health Society, has partnered with local community groups such as Access and Henry Ford Health Systems to participate in an effort known as All of Us, which is a National Institutes of Health sponsored nationwide research program, inviting over 1 million individuals across the US to try and help build the most diverse health databases in history. And I should note that both our community partner liaisons for that project are also Health and Human Service student alums. And not to totally brag, but I've had both of them in my class along with another one of our panelists, Yasmeen. And it is so amazing to see our alumni continue to engage our current students. I'm so proud of the work that you're all doing in our communities. And that really leads us to the perfect segue into tonight's event. So without further ado, I'm going to introduce our panelists and get tonight's conversation started. And we'll turn on their cameras and mics so you can start to hear all of us. All right, so as I introduce our panelists, first up, I have the pleasure of introducing State Representative Abdullah Hammoud, who is serving his third term in the Michigan House of Representatives. He has emerged as a strong voice for civil rights and a leading mind for health policy. He represents the 15th House District, which comprises his hometown of Dearborn. He is a proud son of immigrant parents. Representative Hammoud has been unwavering in his commitment to Michigan and Dearborn for more than a decade. He earned his Bachelor's of Science from the University of Michigan-Dearborn and his Master's in Public Health from the University of Michigan in Ann Arbor. After working for 3 years as a healthcare consultant at the Center for Healthcare Research and Transformation, he felt a profound need to utilize his skills and knowledge to serve as a volunteer with the United Nations Relief and Work Agency in Jordan. During his months there, he led a successful initiative to promote health and wellness among diabetic refugees throughout the Middle East. In 2014, Hammoud was nominated and elected as the youngest board member for the Michigan League of Conservation for Voters. For more than 2 years, he was at the forefront of the fight to protect Michigan's land, air, and water by educating legislators and communities on the need for environmentally conscious policy. Recently, he received the 2018 National Progressive Leadership Award, given annually to one young elected official nationally for championing progressive policies. Hammoud graduated with a master's in business administration from the University of Michigan's Stephen M. Ross School of Business in the spring of 2019. Expanding his business acumen will help him craft economic policy to address the issues of income inequality and to better support the hardworking middle class. In his spare time, if he has any, he enjoys competing in obstacle courses, spending time with family and friends, and engaging in conversations that foster social benefit and growth. Welcome. Thank you for being here.
Thank you so much for having me. That was a mouthful, that bio introduction, so I apologize. Thank you so much.
Thank you. Our second panelist, it's my extreme pleasure to introduce us to Yasmeen Kadouh, who is the founder of Thawra Network, a media company building the most trusted network of news and lifestyle brands for Arabs and Muslims. In 2019, they launched its first series, which you may have heard of, Dearborn Girls podcast, to catalog the stories of Arab and Muslim women. More recently, they launched Typical 3Rab, a TikTok channel that celebrates Arab American culture. Content is currently streaming, and I had bad information. I was going to tell you over 70 countries, and Yasmeen told me before we started it's up to over 85 countries across the globe. She is a graduate of the University of Michigan-Dearborn, where she studied public health and Middle Eastern studies. She has a deep love for community building and storytelling, and I'm so grateful to have her back with us at Dearborn again tonight. Welcome, Yasmeen.
Thank you. Thank you. I'm so happy to be here.
And then finally, our third panelist is Dr. Mouhanad Hammami. Dr. Hammami is a senior health executive with an expertise in strategy and operations. He currently leads the COVID-19 response and vaccination efforts as chief health strategist for Wayne County in Michigan. His professional background includes serving as the Senior Vice President for Safety Net Transformation, Community Benefit, Health, and Well-Being at Trinity Health. In this role, he led the strategy to improve health for individuals and improve the underlying social determinants of health in communities served. He also led work for Trinity Health's community-based delivery models and public health initiatives, and partnered closely with state and national experts to integrate healthcare delivery with public health activities. Prior to joining Trinity Health, Dr. Hammami served as Chief Health Officer and Director of the Department of Health, Veterans, and Community Wellness in Wayne County, Michigan for almost 10 years, where he restructured the department and aligned services to efficiently serve the 1.2 million residents of our most populous county in the state of Michigan. A medical graduate of Aleppo University, Syria, Dr. Hammami completed his postdoctoral research in pediatrics at the Newborn Center of the University of Tennessee in Memphis, and then accepted a faculty appointment at Wayne State University School of Medicine in Detroit, Michigan, and a research position at Detroit Medical Center, Department of Pediatrics. He then received his master's degree in health services administration from the University of Michigan, and he currently helps provide our students with learning opportunities by teaching several classes for us here at the University of Michigan-Dearborn in health and human services. So welcome, Dr. Hammami.
Thank you, Dr. Mouhanad. Good to be here.
Great. All right, so we're gonna get started with our questions. We were pretty ambitious, I'm not gonna lie, with our list of questions. I don't anticipate we'll get to all of them. So I want us to have a conversation and we'll see where our time leads us. And I think however many we get through, we're gonna learn something from each other, and I'm excited. So we've asked each panelist to just start with a brief little intro, 2 minutes each or so, overview of their experience and talk about how their experience put them on a path to where they ended up where they are today. And I'm gonna, for each question, I'll set a little different order so we can kind of rotate voices through. But if we could start, Abdullah, I'll have you start off.
Yeah, so again, thank you so much for having me. And this, do you want me to give me my 2 minute kind of how I got to where I am? Whole thing. Like the bio wasn't enough, so I'll add on to the bio that was already read. For those whom I haven't met, my name is Abdullah Hammoud. I have the distinct honor and privilege of serving my hometown, the city of Dearborn, as state representative. And my path to coming here was, highly unexpected. I was the son of immigrants who always anticipated wearing a white coat, but was unsuccessful in that endeavor. But in my path and wanted to give back and pursuing public service, kind of found myself, ended up running for office. I grew up, the second oldest of 5 children, 2 immigrant parents, and grew up in a working poor family. And for us, success was largely defined as through financial means, trying to find a career that would pay us. We had this strange slogan when we were younger: 6 figures by 26. We just wanted to achieve a 6-figure salary. And it wasn't because we wanted to spoil ourselves with the riches. It was because we no longer wanted to worry about the bill that landed in the mailbox. Having grown up, again, in a working poor family, son of immigrants. And my parents always taught me that education would be my pathway to success. 2 parents who never had the opportunity to go to college told me that if I wanted to succeed in that fashion, education was that pathway. I found myself coming to the University of Michigan-Dearborn, the greatest university of all. And it was really on campus where my political activism came to flight. I ran for student senate. I was a member of our student government. We actually launched our own political party called U.S.A. I was very, thank you, Yasmeen. I was involved in, about 8 to 10 various organizations. We had furious debates with the administration, with the chancellor at the time, all in great spirit. We were able to make many positive changes. And I think that's really what ignited in a formal way my passion for public service. And so when I found the opportunity to run for office, it made sense. We took what we learned on campus and really just brought it into the community that I love. And here we are today.
Great. Yasmeen, I'm going to pass to you.
I'm laughing, Abdullah, because ours was the OMC, One Michigan Coalition, and it's evolved to have these very weird acronyms that I don't think even mean anything, but I was also on student government. So for me, my path was interesting because I always loved social justice. That was my #1 passion, but I was dying to find this niche in social justice as to what would be my cause. And I tried running from Dearborn, and as much as I tried running, Dearborn wouldn't let me leave. And growing up in a city that didn't see the value in itself really pushed me to want to make a change and want to make a difference in my own community, because the stories that I heard growing up didn't match what I saw every day. And so for me, I did not have a linear path at all. I didn't study business. I'm an entrepreneur right now who didn't study business, didn't study journalism. But the media company just kind of found me because of the fact that we were starting this community initiative with storytelling as the basic facet. And through that, it's just kind of spiraled into this thing where a hyper-local podcast is going to turn into something on a more national scale. And Abdullah and Dr. Hammami both actually had a big role in my path as well, because my first job out of undergrad was thanks to Dr. Hammami. And I worked for the public health department and learned a lot about the community through that too, and a lot through community initiatives and how communities work in silo. And it was such an honor to do that. And with Abdullah, I volunteered on his state representative campaign. And for me, it really showed what collective action can do, specifically in Dearborn. And that was like one of the first times I ever saw that, because like I said, growing up in Dearborn, you didn't really get to see the value of the community until things like Abdullah running really spotlighted it, and people telling our stories and starting different initiatives. And that's what's so inspiring to me.
Thank you. Dr. Hammami.
Thank you. Let me just say it's a great pleasure to be on a panel with you, Yasmeen, and of course with Representative Hammoud, who I had the pleasure to be with him. But it's been a while since I saw Yasmeen, and I am ecstatic to see how much this success and all that. So thank
As
you.
am I. I double everything you just said.
Yeah. So just like Representative Hammoud mentioned, to me, it was also doors that were opened at the right time with no preconceived intention to pass through those doors. You know, the tradition, you finish medical school, you get into a residency program, you end up wearing that white coat that Abdullah mentioned, and you go into practice and you see patients and all that. I think the turning point was for me during my academic years at Wayne State when I was working in research, my involvement in organized medicine. And it seems all the roads eventually lead to advocacy and activism at some point. My involvement with the Michigan State Medical Society, my involvement with my own medical organization, the National Arab American Medical Organization, being involved set me on a different path from clinical practice, from seeing patients and assuming that role where it is serving beyond one patient and going outside and serving the public and eventually the community. But I think the aha moment was when I took the position at Wayne County as first as the chief of health operations, then as the health officer. And understanding how in a county such as Wayne County, where you have 34 or 43 actually different cities, how one size does not fit all. And within this relatively large county, if you go from the Grosse Pointes all the way down to Hamtramck and you end up in Ecorse and then you come to Inkster, you literally need a health department for each one of those cities because the needs are so different. And this is where the equity and disparity and the social influencers of health, the social justice that Yasmeen mentioned, all those came to surface, which I have to confess, it is not something that you learn in medical school. Nobody teaches, there is no class that says civic engagement 101 or social justice 101. You know that the disease has an etiology and symptoms and all that, but nobody tells you part of the causes of stomach ache is hunger and part of the causes of depression is unemployment. And I think this is where I developed that passion to do what I wanted to do, and even moving to Trinity, heading their community health and well-being department and transforming healthcare into more a social care is my passion. And here I am.
Great. And the county just needed you back during this crisis. So thank you for your service. My next question dovetails where I'm going to ask all of you to talk a little bit about the decision you've made to commit to this region and immersed in work that is so impactful for the community and to the community. And Yasmeen, you actually mentioned trying to get away and Dearborn not letting you. So I'm going to ask you to kick off this question.
Yeah, so my passion is Arab and Muslim media representation, and the idea that we should be telling our stories on our terms, and the idea that media really transforms the lives of people, and whether we like it or not, socially and politically as well. And Arab Americans and Muslim Americans don't have narrative power. And so the idea that Dearborn should be the beachhead, should be the place that this comes out of, has been something that has really instilled in both me and my co-founder, and it's something that we really truly believe, because Dearborn has the highest concentration of Arabs outside of the Middle East. And that's where the Arab American story should come from. And also for selfish reasons, I love Dearborn. As much as I've tried to run away, I've genuinely just become so attached to the community in ways that growing up, I didn't ever think I would feel this way, because we were never given permission to own our community or our identities or our stories. And so through this work, I've become even more attached to Dearborn. And so that for me has just kind of been everything.
Thank you. Dr. Hammami, why don't you go next?
So there's a myth that immigrants do not, once they land in one place, they do not move from one place. I guess I broke that myth, and I've had my, I call them the pilgrimage between the North and the South. So I landed in Ohio, ended up in Tennessee, then Georgia, then back to Ohio, then back to Tennessee, and now in Michigan. It seems that I migrate north and south. But Michigan, and specifically Detroit, has been the longest I stayed in one place, and that's almost 27 years. So, you know, this is where home is now. This is where you have a family. My wife teaches at Fordson High School. She is a member of the community. My boys, although we don't live in Dearborn, we live in Livonia, but my boys are cultured in the community. It's the convenience of having a home away from the homeland, being part of the community, not feeling that you are a stranger, belonging to that, and also giving back to the community. We as a community have a lot of issues that we need to focus on, and sometimes an outsider bringing those points would feel kind of, the community would be resistant to someone highlighting some of the things that they're experiencing. So hopefully they have more trust with someone that is a member of the community when they bring up this. And I'm loving every minute of it, and the interaction that I have with our Dearborn community, as well as the Arab American community and others in the role that I am serving, specifically now in the pandemic, and understanding that it is, again, not one size fits all. Not everybody believes in prevention or vaccine the same way, and you have to customize your approach to that, and specifically as we're dealing with this.
Yeah, thank you. All right.
So, go ahead. I don't know if I was going next or for the next question. Go for it.
No, you're going. You're going.
Okay. I would say, you know, kind of found myself in Dearborn, although for the longest time I tried to leave. You know, I went to Ann Arbor for my master's program, and then I lived in Ann Arbor for several years after working for the university. And then I found myself moving back to Dearborn once my place of work shifted closer to Dearborn. But when I went and served overseas with the United Nations, I actually tried like a heck to move overseas and actually just have my permanent work location to be with the United Nations overseas back in the Middle Eastern region. But my work placement came back to Egypt. And at the time, it just wasn't, there was a lot happening throughout Egypt, kind of throughout the Arab Spring era. And so I decided against it. Ultimately, I think, you know, 2015, as I was still kind of looking outside, trying to think what I should do, looking for jobs and opportunities. It's at that point that I lost my older brother. He had passed away unexpectedly. And that really grounds you when you bury somebody, when you bury family nearby. And I think it was then that my priorities and my purpose changed. And I realized that being home, being close to family, meant more to me than anything else. And that's what really got me grounded here.
Great, thank you. All right, now we'll do our next question. Is thinking about the pandemic's impact on the community, what have you learned about the community during the pandemic, and how have you had to evolve or adapt your work? And so, Dr. Hammami, I'm going to ask you because you are most definitely grounded in the community with the pandemic response.
Well, the biggest lesson that the pandemic has taught us, not only as it relates to the community, but as it relates to the nation at large, is that we are never prepared well enough. And that can get all the way down into the community. The response again, was a more reactive than a proactive one. And because it was reactive, then we were reacting to a pandemic that hit us with full force, and we needed to react as fast as we can. And during this reaction, we have maybe not paid so much attention to the characteristics of every community, the differences in every community. The high cases that we have seen in African Americans and Hispanic Americans, and to some degree in Arab Americans, the disparities between the socio-economic and cultural differences and the severity are all lessons to why our one-size-fits-all response was not working. The second thing is that there is a great deal of conflicting informations and to some degree mistrust. Unfortunately, this pandemic has been politicized. And because of that, the general public have been torn between facts and misfacts, or misfacts that are masquerading as facts. And all those have added to why it was so hard for several communities, but specifically, I would say our Arab American community have been more hesitant, more reluctant, and more questioning a lot of the information that was circulating. Add to it an extra layer that many of us, at least me personally, belong to at least 6 or 7 WhatsApp groups that cross different continents and different oceans. And they are flooded with so-called experts that would come up with all these theories. And your cousin, your grandmother, your father, no matter what level of education, they will circulate those. And at some point, someone is going to believe in whatever that information. And it is so hard to deconstruct these this misinformation and try to come up with a different strategy. I think these are my top 3 things that I had to deal with in drafting the strategy.
And okay, we couldn't have asked for a better panel, because if we think about what you just told us, I'm going to pivot first to Abdullah, because he can talk about the politicization of what's been going on maybe a little bit, but then also to Yasmeen in thinking about media and the way that information is transmitted. And it's just so lovely to have these different perspectives all together tonight.
Yeah, I'd say the first rule is listen to Dr. Hammami, not to any doctor or your fake doctor on Facebook or WhatsApp. We have a lot of those who, were educated in not the medical field or public health field, yet they understand everything that's happening apparently. Just today at the Capitol, there was actually a rally against vaccination passports. This is a politicization for something that nobody ever brought up. There was not a real discussion. There was no bill introduced to create vaccination passports. There's never been a bill introduced to mandate vaccination. Yet you had a rally with several hundred individuals, and my office is being flooded with, do you stand against vaccination passports? And now there's actually a bill that would fine an individual possibly for the vaccination card that you do get that tells you you've received your vaccines. And so, we're seeing an extreme politicization, and this happened at the onset of the virus. It happened with kind of the dehumanization of the Asian American community and the targeting and the bigotry that came out, and that's rampant and that's climbing. We see it in the economic and public health debates across the country and across the globe over what is the best way to tackle this. What is the priority? Is it preserving the public's health, or is it preserving these small businesses or larger corporations' bottom lines? And which kind of comes first? Can you do all of it at the same time? Now that the virus is kind of, the numbers are kind of climbing down, why can't we just open everything back up again? And it's not debated through the lens of science. It's debated through the lens of the story of this one business owner I know, or the story of this one person who I know who might have lost a family member to COVID. And when it gets debated through the lens of narratives and stories, it becomes more personal and more real for many people. But you lose sight of possibly the data, the facts, the research, and the science. And I think that is what has been so difficult. is, I can't tell a small business owner that, hey, what's more important than your bottom line and your livelihood is the fact that we have to make sure that everybody gets vaccinated before you can open up to full capacity or what it might have been. It's a difficult conversation as a policymaker, as an elected official, to tell this to an individual who's losing absolutely everything that they might have spent their whole lives building. And so it didn't help when we had a certain president in the White House, kind of elevating the politicization. It doesn't help currently when it's still being elevated within the Michigan legislature by various leaders, and it's being elevated on both sides to a certain degree. And so I'm hopeful that balance will come. I think we're entering a time where things will get better. But I think if we've learned anything, the politicization will be injected into just about every major issue. Yet if you look at the facts, over 85 to 90% of all legislation passed in Lansing is passed along partisan lines. But the media tends to focus on that 10%. And so maybe that I'll pass it to Yasmeen as we go into that direction.
Yeah.
Yeah, so I think the idea that Dr. Hammami hit on with mistrust is everything, because specifically with Dearborn, Arabs and Muslims don't have media outlets that we trust. When something happens that uniquely impacts our community, we go to WhatsApp or we go to social media. And when these places are spreading misinformation, like Dr. Hammami and Abdullah were saying, it makes it so difficult for anything to happen in our community. And then you have journalists and you have people writing stories. I had a journalist actually call me and say, I want to talk about COVID with Dearborn. And I said, okay, let's talk. And so I'm not going to name the place just because for other reasons, but she said cases in Dearborn are really high because kids are smoking hookah in their garages. And I said, let's stop with tired tropes and let's talk facts right now. Arabs are considered white, and there's so many different reasons as to why Dearborn has higher COVID cases. And let's peel back the layers. And so it was really interesting to have that conversation and to really open up her eyes with that. She ended up producing a really good piece. She actually interviewed you, Dr. Hammami, as well. So, but yeah, so I think it's the idea of misinformation, mistrust with media, and the idea that when you have people from the outside coming in and telling your story, it doesn't capture the full picture.
Absolutely. My next question picks up on some of this theme a little bit deeper. All three of you have had to learn how to communicate with the public, right? Not just people in your field or in people who might agree with you, but in a diverse community. So what are some of the specific skills and strategies that you've developed to effectively get your message across while ensuring others know that you're still hearing their concerns or making space for diverse viewpoints or recognizing that you're not talking to an audience that's a monolith? Yasmeen, I'm going to put you on the spot to go first.
Sure. I think a common misconception with community building is that the community needs you to tell them like what to do and what they need. And communities are autonomous. Communities know what they want and what they need. They just need people to listen. And so I think that's been a big thing with us with the work that we've done, is just really listening and simultaneously holding the community accountable, but then also being empathetic and meeting the community where it's at, because the two have to coexist to have any sort of progress, because there are people set in their ways with certain things, and you need to be able to have a open conversation, open dialogue, and just really listen to what people are saying. But the idea, I think, mostly is just being open and not telling communities what they need. I think that is just the most disastrous thing you could possibly do.
Great. Dr. Hammami.
I completely agree with Yasmeen. I think it is also plugging in one of the courses, Arab American Health, where this is purely understanding the culture of who you are trying to help. As health providers, we need to understand our patients and where they come from in order to be able to heal them. To go to communities assuming that we know better than they do and coming from a superior position and implying or dictating what needs to be done will not work with any community, regardless of what their background is or their ethnicity. Building a partnership where you are communicating with the stakeholders, you are understanding the issues, and you come from a position of trust where you show the understanding. So the example that Yasmeen mentioned about the media and Arab Americans, I remember literally my first week back to the county, and there is a panel that is hosted by the state that is looking, because Dearborn had one of the highest cases in the county. So the state has assembled a roundtable where leaders from the city, as well as the health department, as well as the schools and several community organizations in Dearborn, discuss mitigation processes and prevention every week. So the first report that I saw was able to split down the zip codes in Dearborn that have higher cases. Mm-hmm. And one specific zip code, when I looked at it, I'm like, I know exactly where that zip code is. And this is where a higher concentration of a certain population of Arab Americans. So we know that Arab Americans are not one big unified or same background. So there are Yemeni Americans, Lebanese Americans, Iraqi. So that zip code which was the highest. I said, well, this is where the so-and-so Arab Americans are. And immediately everybody just froze, and they said, well, we don't want to go there. And I asked, why you do not want to go there? They said, well, we don't want to single one community versus another. I said, but that is exactly what science is telling you, because some cultural, transgeneration, multi-generational relations might apply in Yemen versus in Lebanon. It might be more prominent in Iraq versus in Jordan, for example. And I'm just throwing those, and you need to understand every neighborhood to understand why is this zip code highest versus other zip codes. When you look at a household where the grandparents and the parents and the grandchildren are still living together, because this is what the family unit is when they were back home and they brought it with them here, then you cannot apply the Western medicine to say social distancing and isolation and don't hug grandma if you're sick and all that. So you really need to understand that. And I think this is where this becomes very important as we apply. We've always advocated for, since ever I stepped out of medical school, we talked about cultural competency. Well, we no longer need to be competent. We need to practice it. We need to be not sensitive and competent. We need to truly be practicing cultural medicine. And this is the time for it, specifically when we talk about prevention, when we talk about vaccine, when we talk about health behaviors and risk factors.
Great. Abdullah.
Yeah, so, Dr. Hammami nailed it, as well as Yasmeen earlier. Mm-hmm. When you speak to diverse communities, you want to speak to them where they are. So one of the first things we did actually when the COVID pandemic hit, I launched the first COVID WhatsApp group chat. And we sent out a link saying, if you want to join this group chat, only I will message, and I will message the facts. The first group chat failed in 10 minutes. We launched a second one. The second one failed in 30 minutes. We launched a third one. The third one failed. And so I'm operating 3 WhatsApp group chats almost on a daily. And I send out messages on, here's the update, here's where we are in vaccination, here are the resources now available. And so, because I know once you send a message on WhatsApp, then we have, County Commissioner Sam Baidoun, who tends to translate these messages for us. And so now we're doing it in multiple languages. But it's extremely important to communicate with individuals where they are. But it's, and sometimes you code switch, right? And when you're with a community, you tend to start talking in the language or in the terminology that this community is used to. But there are some downsides. The downsides is people from outside of the community might not know what you're speaking about, or might mistranslate and kind of twist the intent behind words. And I'll give you the perfect example. Just last week, I was at a mosque, and I was speaking to the mosque about the importance of elections. And I was speaking to a community that is not represented and currently in city politics. And I said, if you want to be represented, you need to come out and vote. And if we all voted, you could determine the outcome of every single seat in the whole city. Individuals saw some footage, posted it, and said, Hammoud says we only want Arabs and Muslims in office. He's saying only vote Arab and only vote Muslim. yet my intent is speaking in a layman's terms to an audience where English is a second language about the importance of voting if you want representation. And so it's difficult to go back and forth. And if you're in a room where you know people English is a second language, and then for some English is the first language, or the cultural differences are different, you have to, it comes with time, it comes with experience. But effective communicators, I believe, make it the furthest in any profession, hands down.
Yeah, thank you. All right, so the next set of questions, we're going to switch gears a little bit, less about the pandemic and more putting on our alumni caps and thinking about students and lifelong learning. What advice would you give to your undergraduate self today? Hammoud, yeah. Abdullah, why don't you start?
Yeah, I was waiting for Yasmeen to go. I was the undergraduate student that thought far more important to be active in extracurriculars than worry about your GPA. And I think, when I never got into medical school, I always blamed myself for that. So I think if I'm able to go back, I'd say you did the right thing. I think the skill sets and the experiences I got out of being more involved on campus, the relationships I built took me further in life than an A in any classroom could have. I think that's one piece of advice. Secondly, for those who are able, if I can give myself the advice again, is travel while you can to go learn abroad, to emerge into various cultures. I saw my younger brother do it, and I think I was so jealous. Every summer in undergrad, he traveled to a different part of the world and took courses and learned of new cultures and new experiences. And I wish I would have told myself to do that when I was younger. I was too scared to travel alone at the time. And so I would have told myself, break your shell, get out there and go explore.
Great. Yasmeen.
I would probably tell myself not to be so afraid of my dreams, because I think I spent a long time not believing in my potential, partly because of imposter syndrome and like whatnot. But one of my favorite quotes is James Baldwin quote, where it's the place in which I fit will not exist until I create it. And so I would tell my younger self to really embrace that and to just really take every single experience that you have as a learning lesson, and not necessarily as a rejection is not necessarily a rejection, but a redirection. So yeah.
Great. Dr. Hammami.
I don't know if I can top what Yasmeen said, but along those lines, take the road that is not taken before. There is no preset. It's not a mold. Not everybody should be a doctor and a engineer and all that. Not there's anything wrong with choosing that. But if you want to do something else, then go for it. Don't be afraid of following your passion, because this is what you're going to end up with for the rest of your life. So you better love it. Otherwise, you'll be miserable.
Great. All right. So this was just a follow-up question. So I'm going to toss it out, and whoever wants to speak to it can. I'm not going to force you all to answer. When you think of our region and the near future, what challenges do you think we're facing? And what do you think specifically M.H.S., Health and Human Services, or the University of Michigan-Dearborn can be doing to help prepare students to meet these challenges?
Let me answer the latter part, and then
Okay.
I'll let Yasmeen maybe. Yeah. I think, and forgive my math. So now the College of Education, Health and Human Services has been what, 6-7 years now?
About 7, yeah.
About 7 years, yeah. That was a great landmark in translating or probably marrying theory and practice. And we need to continue to do that. There are so many institutions that are out there that are graduating excellent theorists, but there are less practitioners. And bridging that gap between theory and practice is what we need, specifically when we talk about the community. I can go and give lectures until forever. That lecture isn't going to help anybody until I translate that into a program. And this is what the school has been successful in doing and needs to continue in putting the theory into action and into programs.
Thank you.
I think Dr. Hammami nailed it. I mean, the challenges we face are so many. It's everything we were facing, right? Public transit, roads, infrastructure, now plus emerging from a post-pandemic reality with a the idea that we are going to live with this virus forever. We might never reach herd immunity. Now that's what the research is saying. It's possible we might never reach herd immunity. Too many variants, not enough vaccinations being given out. How do we now just adjust to this life with COVID-19? Economic burden, small businesses shutter their doors. How do we have a spur to open it back up? And so I think for me, more broadly, the university can help along the lines that Dr. Hammami spelled out of practicality. But I think you can also serve as the institution that, various levels of government partner with. If there's a small business incubator to be launched, work with the University of Michigan-Dearborn that produces the brightest and the best. If there are public health challenges that arise and we need solutions, bring the challenges to students. And in my experience, it's always been young people that have bold, innovative ideas. And we have to now think outside the box. That's what helps move us forward. We can no longer be stagnant. And if you think about Dearborn as a whole region, we are a commuter city, just as University of Michigan-Dearborn is a commuter school. But what happens in an era where commuting is no longer a workplace norm? You are no longer driving to Dearborn to spend your dollars at our local restaurants. So how can Dearborn help be a flagship to now say, move to Dearborn because this institution is here? And that's how you bring families and resources back to the city. And so I think University of Michigan is one of the premier assets of the city. I'm not saying this because I'm an alumnus or because I'm an elected official for the region, but you are. And I think your role and your importance is only going to increase.
Okay.
I think the only thing I would have to add, I think the solution to the problems is electing people like Abdullah in office. No, I'm being serious. Abdullah, the idea of fresh and innovative ideas is something that is lacking in government. And having people like Dr. Hammami in positions that he's in is what we need as well, because he's such a great advocate for the community as well. So I think just making sure the right people are holding positions of power, because there's a lot of people, diversity and representation for the sake of representation doesn't do our community any service at all. And so I think qualified representation is huge. And that's kind of why I vouch for obviously both of them. But
I'll send you my Cash App payment right now. Thank you so much for that.
So to answer the last section of that, what role can alumni play? I think we're looking at two roles that are being played right now on this panel. And these are great examples. Once you graduate, don't leave. Just put your hat on and your boots on and work in the community with what you have learned.
Thank you.
Or come back. If you did leave, come back. If you
Absolutely.
got that experience, come back and try to put it to work.
Right. I think there's often something about the itch to leave and the total reward of coming back, right? When you get that investment, you might have needed that time away to learn the gem of what was waiting for you at home. Okay, so our last formal question, and then we'll save some time for the audience to ask a question or two. I always like to end, my last question was about challenges. And I think in the public health community, we often get focused on the challenges because we're trying to come up with solutions for big problems, but that can sometimes have us overlook the opportunities and the positives that are going on. And so my last question is really, what do you see as our greatest opportunities in the area and in the region?
So many.
Great.
We have the opportunity. I mean, the one silver, I think this is the biggest silver lining to the COVID-19 pandemic. And I hate to frame it in this way. If COVID-19 revealed anything, it was that government agencies do not work as they are currently designed. It's been very clear, whether it's a matter of trust that Yasmeen alluded to, whether it's a matter of how they are constructed, whether it's a matter of who they are actually supporting rather than the greater majority, as we see with the disparities that have emerged because of the pandemic. And the silver lining we have right now, we have a record level of investment we've never seen. And we have the opportunity to now reconstruct government agencies to work for working people. I don't think we're going to come across this for another generation. And so I think the greatest opportunity we have is, are we built for the task of rising to the occasion and saying, hey, we have failed the last 100 years and this pandemic showed us we have failed. How do we turn a new page and begin to start anew? And so I'm excited for that journey. And I think that is the opportunity of our generation, is to redefine American society.
Let me add to that, and you're absolutely right, Abdullah. To add to it, that there is also, this pandemic has showed us that if you want government to work, it can work. Mm-hmm. We had broke down red tapes and bureaucracies and moved mountains when there was a will. Mm-hmm. We were able to produce a vaccine in 6 months where it used to be 6 years. So a leaner, more forward-thinking government is probably what this pandemic has shown to be needed. And also, it has proven that when people work together, then there is nothing impossible. So breaking down the silos and approaching this as a multi-pronged thing that you can implement has really shown that it is effective.
I mean, I couldn't agree more with both of them. I think the one thing I would add is just collective action of communities. But yeah, beautifully said, both of you.
While we're waiting to see if any questions come up, is there anything any of our panelists would like to any ideas or thoughts you want to close on or leave our audience with?
I would be probably remiss if I don't put a plug in for public health.
Great.
We know that we have done, since December, the first dose that we got of the vaccine, we know that we have literally moved mountains. And to think of where we are now with a vaccination rate of close to 50%, that encompass the most vulnerable. In fact, our vaccine rate in the 65 years old and over is almost 75 to 78%, which is what we want for herd immunity. That has been a great accomplishment. But now that we are at 50% and we need to get everybody to that 70 or 75%, this is where the hard work is going to be. And those that are still and not vaccinated is also the group that is hardest. We are talking about the 20 to probably 45 or 49 years old. And I know probably many of those are listening to us or will be listening to us, but they are also those that we see on a daily basis amongst our students and people that we encounter in the community. And if you are still reluctant and you are hesitant and you haven't decided to get vaccinated yet, then please reconsider, because we know that the vaccine works. There are statistics that are showing that it works. And what we are seeing in terms of the drop in the curve and the flattening of the curve is a true testament about that the vaccine is working. So don't waste your chance and don't put yourself and those that you love at risk.
I think that's a great message to end with. We did have not a question, but a comment from one viewer, another member, another professor in our department. Dr. Sampson just said, no questions, but thank you for all of you, for each of you to advance social and environmental justice and health equity. She's so proud to be part of the U of M-Dearborn community and to have you be part of our community. And I just wanted to thank you all so much for the generosity of giving us your time and your thoughts. And I don't think we could have pulled together a better panel to talk about these issues with. So I thank you all so much for your time.
Thank you.
Thank you very much.
It's been a pleasure to be with all of you.
Good to be with you guys as well.
I'm waiting for the superhero action figure of Dr. Hammami so I can have it on my desk one day.
Yes. If you don't know, he is often referred to as the Dr. Fauci of Wayne County.
Yes.
You didn't know.
I love that.
But way cooler.
But way cool. That always comes too. Yes.
You can
but
see
way
his
cooler.
shirt. You can see the floralness to his shirt. We
Yeah,
can't tell
yeah.
100%,
Yeah.
but I know it's got swag.
He dresses
I'm
way
glad,
better
I'm
than
glad
Fauci.
it's Zoom where you cannot see me blush, but thank you.
All right. Goodbye, everybody. Have a great evening.
Hi, everyone.